And it's up to you if you want to give it, a couple more minutes for people to. I know that when I'm have a time for a meeting, it seems like something always goes wrong with my Zoom when I'm trying to log into the meeting. So maybe if we just give them a few more minutes.
Yeah, that's fine. We can hang on for a few.
Okay. And I just started the record of the meeting.
Okay.
Hi, beautiful.
Hi. Thanks for tuning in.
Mm-hmm, of course.
Right. All right, I'm just working on being able to share my screen, and we can get started, I guess. All right, what do you think? Should we get started?
Sure.
All right, can you guys see me and my first slide?
Yes.
Okay, great. All right. So thanks everybody for joining today. I'm Anna Mazor. I'm one of the breast surgeons at Comprehensive Breast Care. And I've been with the practice for 8 years now. I know some of you, but not all of you. And I'll share a little bit about myself first. I'm a breast cancer, BRCA2 previvor, family history of breast cancer, my mother and my aunt. And so, it's been very important to me to do all the things that are in my power to reduce my risk of breast cancer. And about 6 years ago, I found myself extremely overweight. I felt horrible. I just had two children. I finished surgical residency. I started a job as a new attending. But I woke up every day with pain, swelling, fatigue. I would come home from work and just plop on the couch and unable to do anything. And I had two little kids. And um, in addition to feeling horrible, I knew that in my imminent future, my my risk reduction surgery was around the corner, which is a choice that I made and a very personal choice. But I knew that if I didn't lose the weight, one, my breast cancer risk would be pretty darn high. It was already 80, 60 to 80%. But I might get it younger, I might get a more aggressive form. And if I did have surgery in that condition, I knew that my chances for a very good result with minimal complications would be lower. So I embarked on my fitness journey and my health journey back in July of 2020 when I had to learn pretty much from the beginning how to eat well, how to get the rest I needed, how to hydrate, how to act, yeah, and what to do in terms of moving my body. So, I for a while, I was very low carb keto. I started Pilates about 6 years ago. And I have not looked back ever since. I'm 100 pounds down from my original weight in July of 2020, and I'm very proud of that. And I worked very hard, and I've changed almost everything in my life. Something that I am very passionate about, and most of you guys who know me really well, especially my patients, know that, we talk about lifestyle risk reduction all the time because breast cancer recurrence is something very real and associated with being overweight and obese. And in this country, 70% of people are overweight and obese. And so and I get 15 to 30 minutes with you guys, and I can, impart the wisdom that I've gained on this journey. But a lot of it is something that, we have to work on getting resources to our patients that are outside of the office setting because I can only do so much. So I felt that it was really appropriate and important to talk about resistance training because I am learning and I have learned over the years, that it is a very critical component of maintaining a healthy weight. And it turns out it's also a critical component in reducing your breast cancer recurrence risk. Um, and it is something that I wasn't really aware of. I grew up in the age of, my mother telling me, don't lift weights, you're gonna get big and bulky. As if being strong is bad. But that sat with me. And I remember going to the gym in college and being on the cardio, being on the treadmill or on the elliptical for 45 minutes. Like that was going to make me healthy and thin. And yeah, we need cardio, but it turns out resistance is really important. So, I thought it would be appropriate in this case to say, lift like your life depends on it, right? So, why does it matter? And we already sort of touched on this, but why does resistance training matter so much for our breast cancer survivors? So, we know that resistance training builds and preserves lean muscle mass, and that helps support appropriate bodily functions in terms of agility and mobility. Um, so having enough muscle mass as you get into your postmenopausal years and then your, 60s, 70s, and 80s, if you don't have the lean muscle mass, you will lose your mobility. It also shows, studies have also shown that it supports bone health and reduces the osteoporosis risk, which we know, or most of us should know it, if you're, paying attention to your healthcare, that the aromatase inhibitors that we prescribe to reduce estrogen positive breast cancer recurrence are significantly associated with osteoporosis. So it can worsen your bone health. In addition, we used to think that lymphedema was worsened or increased by weightlifting. And so I've heard therapists say, well, you have to stick with light weights, no more than 5 pounds. But as it turns out, when done correctly, resistance training can actually reduce your lymphedema risk. That is a really important component of maintenance in women who suffer from lymphedema. In addition, a lot of our treatments, chemotherapy, radiation, aromatase inhibitors, tamoxifen, can cause significant fatigue. So, with resistance training, you can reduce that fatigue and improve your quality of life, your mood, your, uh, you know, reduce depression and anxiety. Um, and like we already just discussed, it does reduce cancer recurrence and it is associated with improved survival in our breast cancer survivors. So, this can aid in overall quality of life and help you maintain your independence as you age. Um, now, I just wanted to highlight this really lovely story that I found when I was doing my research for this talk. This is a young woman who was 27 when she was diagnosed with a stage 2B estrogen positive breast cancer. And prior to her diagnosis, she was a competitive power lifter. I mean, these numbers are insane. She could squat 441 pounds. I mean, that's just incredible. So with her team, she sort of devised her own sort of research study on herself, and she sought to maintain her strength during her treatment. She underwent 4 cycles of TC. She did a mastectomy, and then she had radiation to follow. So she designed a program where she matched up her training sessions with her chemotherapy, um, and did high intensity days maybe before her chemo infusions, and she would focus on squats, bench press, deadlifts, big muscle groups. She had some moderate days that would be in between her chemo sessions, like mid-cycle. And then recovery days were like around her, infusion. So couple days after her infusions, she would do some mobility, light mobility, but avoided those strenuous exercises. And then she kept a log, and she would, log how much weight she was doing, how she would feel that day. And by the end of her treatment, what she found, her and her team, was that she maintained 93% of her squat strength and 87% of her bench press and deadlift strength. So that is pretty impressive for someone going through chemotherapy to be able to do this. Now, she is an elite athlete, but it just highlights the importance of, trying to maintain this sense of normalcy for her mental health, which she did, and preserve her muscle function, which ultimately will, she'll be able to go back to her, previous, pre-treatment strength, and hopefully, never have to, fight again. So, there is a link for this article if anybody is interested in reading the article. It's a short article. Um, this slide just shows that, you know, there's some good evidence about the different side effects and the effects that exercise has on them. And so I just wanted to show here that, let me see if I can do this. Um, Hold on, I'm getting a laser pointer. Lymphedema uh, has good evidence that if you do 2 to 3 sessions a week of progressive supervised program, you can reduce the risk of lymphedema. Um, if you combine aerobic, which is cardio, and resistance training, You improve and maintain your physical function. You improve and maintain your quality of life. And really, of note, cancer-related fatigue is significantly impacted by a combined exercise program. So important before you get started with something like, a new powerlifting regimen, is that you make sure that you go over your, health status with your team. So talk to your surgeon, talk to your medical and radiation oncologist, and make sure that it's appropriate for you to start a program like this, right? I mean, if somebody has significant osteoporosis, it may not be safe to just start lifting heavy weights because then you may have an increased fracture risk. Of course, discuss all your medications. You might need to consider where you are in your treatment. Are you doing chemotherapy and are you struggling with neuropathy? You might need to modify some things due to that. Make sure you go over what, appropriate things to do with your particular status of your lymphedema. And then start really slow. That is the key, especially if you're new. And learning proper form is critical. So you can't just go in the gym and just start doing things willy-nilly. You really need to be able to maintain a good form so you don't injure yourself more. Back injuries, joint injuries, they're common for people who are sort of naive and just jump into a program. So these are, I don't want to encourage you I want to encourage you to do this, but you have to do it in a safe way, right? And make sure you are looking out for how if you are struggling with lymphedema, how are you feeling after each session? So monitor for new pain, numbness, fatigue, swelling, and obviously you need to make someone on your team aware if they occur. So the basics of resistance training are to, you know, challenge your muscles against a resistance. So load your muscles with some resistance. All right. And the goal is to improve your energy, like we said, reduce fatigue, bone health, improve your independence. So when you embark on this journey, you really want to start with maybe 2 to 3 days per week that are not back to back, giving yourself a break in between, and begin with light weights. You may do 2 or 3 sets, probably start with 2 sets of each exercise and aim to get between 8 and 12 repetitions, right? So using that muscle group, 8 to 12 times and do that 2 to 3 times in a session. In general, you want to increase your repetitions and weight very gradually. Usually, repetitions are increased first, and then you can add on weight. But you don't need to do more than usually 12. Um, you also want to make sure you're working the major muscle groups and exercising for about 30 to 60 minutes. Make sure you have a good warm up and a good cool down. All right. All right, I think that's all for that. In addition, make sure you're putting in a light cardio session 2 to 3 days a week, right? So you don't need to get on the treadmill for 45 minutes, but maybe a 15 to 20-minute walk, or if you do run, you can do that, but you certainly don't have to. Cycling, swimming, and make sure you get a couple rest and recovery days in between. Okay. Another thing that is really important is to track your workouts. So make a log with the date, which exercise you did, how many sets you did, how many repetitions you did, and how you felt. You have many options for equipment. So I talked about, things that I do. Pilates is a type of resistance training, especially if you're doing reformer Pilates, which is the type of Pilates that I've done, which are springs, spring-loaded resistance. But you can use your own body weight, certainly. Squats, push-ups, lunges, step-ups. You can also use light dumbbells. If you have access to a gym, you can use the machines. Again, start at the lowest weight. And resistance bands are really great because they're really portable and you can use they're multi-function types of things. So, you have to look at your lifestyle and what you have access to and what's affordable for you. But there are so many options out there. You can also, I think it's important when we were talking about form, which we'll talk about more in a second. There's so much free stuff on YouTube, right? So there's like videos upon videos of weight training exercises that you can do. And there's a couple good ones out there. I've done them myself. So when you are doing, again, just to remind you, so important things for your technique are warming up, right? This is when you might want to do your light cardio too. You can warm up for about 10 minutes, making sure your muscles are getting some blood flow. Maintain really good posture, move with control. Make sure you breathe. Breathing is extremely important. You do not want to hold your breath and start exerting a strong force, right? That's how people get hernias. So breathing, timing your breath with the exertion, right? Usually breathe out on exertion. Making sure you're getting a full range of motion within your own comfort level. So if you have a bad shoulder, you might not be able to do that full range of motion, stop, where it hurt, where it's comfortable for you. Make sure you keep your shoulders, and this is a really big Pilates thing, shoulders back and down, right? Core engaged during these movements, during all of the movements, right? So one of the things that I think helped me so much now that I'm actually lifting weights, because that's what I've been doing for the last couple months, is understanding how to engage my core and keep my posture intact while I'm doing these exercises. And that has kept me so safe and something that, for me, I needed Pilates to teach me. But, these are things that you could practice on your own as well. I need to take off this laser pointer. Okay. So, here are some, I just kind of looked up like beginner exercise routine. What are some things that might be doable for most people? And you can look up pictures and you can look up videos of these exercises. Certainly something that's super easy to do would be a goblet squat. So you hold a dumbbell right in your arms in front of you and you squat down. In squatting position you have to be really, if you have bad knees, this might not be the exercise for you, but in general, keeping your knees behind your toes, right? You shouldn't be arching forwards or backwards, making sure your spine and your core is engaged, your spine is straight and your core is engaged. So maybe 2 sets of these, 8 to 12 of these. A bent over row is a good one for, your upper arm muscles and your lats. You can do a chest press. If you don't have a bench, you can certainly lay on the floor and do a chest press, right, with 2 dumbbells. Everybody loves Romanian deadlifts, these RDLs. Here, I'll see if I can these RDLs. But I will say, you have to be cautious starting out with these because I think that is an exercise you can really hurt your back if you already have a bad back and you're not good at engaging your core. Um, again, you can tailor your exercise to what fits you. And then making sure you're stretching is really important for your cool down. I mean, that is critical. Otherwise, especially I've noticed just even in my 40s, if I don't stretch appropriately, I'm in pain the next day. So nobody wants that. All right. So the goal, though, with resistance training is eventually to progress, right? To lift more and lift heavier as time goes on to build muscle, right? To cause muscle hypertrophy. And that is also so important because we really significantly lose muscle mass starting in menopause and going through, up until we leave this planet. So if you build your muscle now or when you have the opportunity, you won't lose as much later, right? So adding weight is probably what you wanted to do second, right? We talked about maybe adding repetitions first. So if you could only do 8 of those, work on getting to 12. And then if you get to 12 and you're comfortable, then you can increase your weight by 2 to 5%. In your first week, you might want to start with 1 to 2 sets, like we said, light resistance, focus on your form and breathing. By week 3 to 4, you might increase your sets and your reps, do a slightly heavier resistance once you've reached that rep goal, and then keep going from there. If you're getting really sore, even, if you're taking a day in between and you find that on that day that you're supposed to work out, you're really, really sore, don't increase your resistance, right? You can keep it the same. Focus on your form again. You can always what we call deload, or go back down in weight and listen to your body, right? So, on days that I'm really sore, I'll just put my weight down a little bit, or maybe just do less. If you're experiencing a high fatigue day, right? And that could be caused by just living life, right? Um, don't use that day to increase your resistance. So in general, shouldn't have to say this, but I'll say it. If you're getting sharp pain, if you get joint pain, if you get numbness or dizziness, stop what you're doing. If it persists, obviously call your doctor. Um, Dizziness, in general, if you're not breathing well, right, you might be valsalving. If you're dehydrated, if making sure you're really well hydrated, but if you're not, you might experience dizziness. So that might be a warning sign to you that something's not right, and maybe you shouldn't do that exercise that day. Of course, we already talked about, but look for new swelling. And if you have chest pain or shortness of breath, that's a red flag. Okay. Call your doctor or go to the ER. So, considerations for lymphedema, really, they stress that with lymphedema, you really want to focus on higher frequencies and lower resistance in general. But that doesn't mean you have to stay at low resistance. I would just say that you have to very, very, very slowly and cautiously increase your resistance. So, yes, you may have to start at a light weight of 2 to 3 pounds for your upper arms, but you're not going to, necessarily not be able to increase that over time safely. In general, if you have a compression garment that you're instructed to wear, this would be the time to wear it. So you really should wear your sleeves or your chest compression during your exercises. An improperly fitted bra or improperly fitted clothes or garments can exacerbate lymphedema. And as somebody who has chest wall lymphedema, I can tell you that it is awful to deal with. So you don't want to exacerbate your symptoms. You really want to do this safely, okay? All right. Again, work around if you are on active treatment, work around your chemo days, work around your radiation days. Exercise when you know you have a peak energy time. Usually after a couple sessions or cycles, you know what days you're feeling better and what days you're feeling pretty lousy. If you are someone that has neuropathy, that has struggled with neuropathy, you might want to invest in some gloves or grippy gloves, orthotic shoes, things to help you with your ability to grasp. Okay. And make sure you go really slow and maybe rest more in between sets if your neuropathy is significant. Of course, if you're already at baseline dropping things because of your neuropathy, maybe not a safe time to start this. But once it's improved or under control, you can use these tools to help you in your journey. And then it's really important to get rest and good rest, right? Quality sleep, 7 to 9 hours a night, which most people don't get. And eat adequate protein. You can't build muscle without adequate protein. One of the things that I have significantly focused on over the last few years, I do try to minimize the carbohydrate content in my diet, specifically like processed sugars and processed carbohydrates. But increasing protein has a significant impact on your ability to build muscle. So, in general, you're supposed to get about 1 to 1.5 grams per kilogram of your body weight. Um, there's online tools you can use to sort of try to calculate that and aim for a goal. But generally, I mean, most Americans are not eating enough protein, nearly enough protein. And there's this idea called the protein leverage theory that when we significantly decrease the protein consumption in our diet, we will overeat carbohydrates and fat to compensate for that lack of nitrogen and amino acids. So making sure you have a diet that's high in protein, low in carbohydrates will, of course, just enhance your function, your ability to maintain your muscle mass, and you will be leaner overall. And so, I mean, I haven't really talked about, weight management, but the best way to burn fat is to build muscle. And if you're combining building muscle with a higher protein, lower carbohydrate diet, you will lose weight. You will be leaner overall. So, it's really important to try to stay motivated. Some things that might help are making things convenient for yourself. So if you're not really motivated to work out in your home, that might not be the best place for you to do your exercises. And if you have the ability and you have the financial ability to go to a local gym or a community center, you might want to seek out, maybe 1 or 2 sessions a week there to help keep you on track. We talked about logging. It's important to log. You might also want to log your weight while you do it, and making sure you have the equipment that you need. I was just talking to someone today, who has financial constraints, and I talked to her about free YouTube videos. I talked to her about resistance bands. They're really cheap. You can order them on Amazon, right? And you can look up, resistance band workouts for women on YouTube. Um, Celebrate small wins. So any small wins, maybe your pants are fitting better, maybe you have more energy, right? These are all really subtle but important things to take note of and congratulate yourself for those little wins. There are so many survivor-friendly classes out there. Grab a buddy, you know, from the support group or someone that will help keep you on track. Having a workout partner can really help you stay motivated. And maybe if you have the ability, you might want to do a couple sessions with a trainer. Of course, this trainer should be familiar with breast cancer survivors and breast cancer treatment. But that might help you get you started and on track. So I just linked here a couple, really good survivorship programs. So we at Redeemer have a strength after breast cancer program run by one of our lymphedema therapists. And it's been a very well received program, and they work out, I think it's once a week. So that's the link here. Live Strong, everybody probably has heard of Live Strong. They're at the local YMCA. I did check, they have it at the Willow Grove one. That's the one closest to me. And then Living Beyond Breast Cancer has an online video program called Be Active for breast cancer survivors. So these are some nice, easy to access resources. Okay, so just to summarize, how do you get started? Make sure you talk to your team, find equipment that works for you, focus on a couple core exercises for the first week, and don't set your goals too lofty. You're not going to, don't say, I'm going to work out 5 days this week if it's your first week. Pick 2 to 3 sessions like we talked about. So maybe one day, Monday, Wednesday, Friday, whatever seems realistic for your schedule. Learn proper form before you get started and track, track, track. Okay. So, in summary, I think resistance training is a really valuable and important component of our survivorship care, and we really should talk about it more. We need to help support our strength, our bone health, our mental health, quality of life, um, and how we feel about ourselves during this journey, because I know that self-esteem is also something that's impacted. And when you see your body move, when you see your body moving or improved in its movements, and you see small improvements in how you look in the mirror, I think that can really help combat some of the self-esteem issues that go along with some of the treatments that we use to cure breast cancer. All right, and then my last slide. This is why I do what I do. My little boys, who are wild and energetic and help me keep my core strength. And this is me at the gym, working out and building muscle. So, any questions? Bueller? Anybody in the chat have questions? I don't see. All right. Well, it was my pleasure talking to all of you, and I hope you got something out of this. Um,
Thank
I'm
you.
I'm guessing it's recorded. And if anybody needs links to any of those resources that I talked about, I'm happy to forward them. So you can all.
Anna,
Yes, Susan.
do you do any of this with your kids?
Well, I try. I mean, I do, sometimes I'll go to the basement, and we have just some free weights in the basement. And my little one, he seems more interested, so we'll go to the basement and he'll do it for a couple minutes, and then he loses interest and starts running around. But my boys know, and we talk all the time about how important it is to stay fit, in order to stay healthy. Um, they when my little one, I think it was my little one, had like one of those like I love my mom Mother's Day things, and they asked them the questions, right? And
Mhm.
they said, what does your mom do for work? And he said, Pilates.
Oh, I love it. That's so cute.
Yes.
I think you're a really good role model for the kids,
Hmm.
in addition to the women. But I really think you're a great example for them.
Thank
And I mean, it's such a good thing, really, what you're
you.
doing.
Yeah. And it's funny because they don't really remember me, but like I've shown them pictures like this is mommy before, like when she had you, and
Good.
they say the things that you expect kids to say, but I hope that, they take it to heart, right? Like that it's just so important to take care of your body.
Well, hon, could you have done what I'm looking at? This looks like it's your older son. So you've got him up on your feet. Is that
Yes.
something you would have done before the training?
I might have tried. I probably would have gotten hurt.
Exactly.
Yeah,
Right.
I
I
couldn't
just,
with that. Yeah. I
it's
couldn't. My
impressive.
back would have suffered, right? I mean that the older one, he's, I don't know, 65, 70 pounds, you know?
Hmm. So you said something about your back.
Hmm.
I mean, what's the best way to word this? I mean, if someone is dealing with spine issues, is this
Yeah.
something that, and have you had that? I don't know if you have or not, but
Yeah.
can that
Yeah.
help,
Yeah.
strengthen the spine?
Yes. So actually, I have. Funnily enough, when I was in residency, I somehow herniated my disc, my L4, L5 disc, and I was in excruciating pain for months. It hurt to just sit. And I didn't have time to do anything the right way. And I just suffered through it. And then eventually I think it healed enough. And then I had actually got pregnant. And I think when you get pregnant, there's a hormone that's released called relaxin. And I think it just created a little bit more space in my spine. So the pain sort of subsided. But then right after that, when I was struggling with my weight, my back was killing me all the time. I think I was in pain all the time.
You
Um,
did say that.
yeah, once I started Pilates, I mean, knock wood, I have not had I have not had back problems since then. I really, because I've maintained such good core strength, I can't tell you the last time I had something wrong with my low back. Um,
Mm.
I have neck problems, but I think that's occupational. But yeah,
I'm glad you
Mm.
said that. I mean, for me, friends have validated that Pilates seemed to have helped them more than yoga. I mean, I've done yoga too, but Pilates seemed to be what has helped the most with the spine.
yeah, I actually have hurt. I love yoga, but I've hurt myself several times in yoga because you can easily overstretch.
Yeah.
And for me, I found a Pilates studio where it's very small. My instructor is very experienced. She watches exactly what you're doing, how you're doing it, and making sure that you're staying safe, right? So, especially with reformer, you can get really hurt if you don't know what you're doing. And so she really focused on and we have a lot of people. I've worked out with women who were actively in, PT for their, low backs. And if you do it the right way, you can still work out even if you have back pain if you do Pilates. Um,
Mhm.
yeah. But again, I mean, you don't get as much, the osteoporosis risk isn't reduced with Pilates. Interestingly enough, it's probably not enough resistance, but any is better than none.
Hmm.
Yeah. Yeah.
And there is
Mhm.
a lot more focus these days too. I was just reading an article about how people are focusing on mobility exercises. So Pilates is a mobility, right? It does help you maintain your mobility. Again, I've worked out with women in their 70s and that have been doing Pilates their whole lives, and they're in great physical condition. But I also have patients that have lifted weights their whole life. I have an 85-year-old ovarian cancer BRCA patient that's like a power lifter. I mean, she
Wow.
just is doing, yeah, she's in fantastic. She doesn't lift as heavy as she used to at 85, but she's in fantastic physical shape.
That's nice to know. That is good to know.
Mhm.
Thank you, hon.
I think if you don't move it, you lose it, right? I mean,
Oh
that's
Yeah,
yeah.
like everything else, right?
right.
Yep.
I agree.
So, unfortunately, we live in a really sedentary society, and you have to go out of your way to move your body.
Hmm.
It's what we need for our health, though, for life.
We do, we
So,
do.
yeah. Thank you.
You're
Thank you.
welcome. And of
Mm.
course, we need to focus on our food consumption in this country and, whole
Yes,
foods.
yes, we do.
Mhm. Eat the rainbow.
Yeah, get rid of the processed stuff.
Mm.
I think most people may not be aware of just how much of the food is processed.
Ugh.
I really
Mhm.
don't think they are.
I don't think they are either. I
Mm.
don't think they
Mm-mm.
are either.
So, but this was a good presentation. Thank you.
You're welcome. Thank you.
Yeah.
Thanks for your input.
Your boys are adorable.
Thank you.
You are.
They keep me on my toes.
Of
Looks
course.
like they would. Yeah.
Mhm.
Well, thank you. It was
You're
terrific.
welcome. All right, great. Well, if you guys don't have any other questions, um, oh, someone said that they belong to the Y, and yeah, look into that Live Strong program.
Thanks, hon. I did want to ask you, you had mentioned the Pilates place. Is it near you? Is it in the area?
Yeah, I go to a really small studio called Pilates by Linda. She's in Jenkintown on Old York Road.
I was
Mm.
just there
They,
today.
mm.
So, wait, is it near something in Jenkintown that it could?
It's So it's like across the street. It's in this little office building. It's across the street from Beth Am, the synagogue, and Trader Joe's, and
I
yeah,
know where you mean. Hmm.
yeah. There's like
Thank
a
you.
dentist office in there and a PT office in there, and yeah.
No, that's
Mhm.
super. Thank you so much. What really got me was the fact that this was someone that's experienced in working with people with spine issues.
Oh yeah,
Mhm.
yeah. I mean, she has a lot of experience, and so there's the owner, Linda, and then the other instructor, Margaret, have, really helped a lot of people who have had all sorts of, there's somebody that I, worked out with that was in a bad car accident and, somebody that has shoulder problems,
Mhm.
I've also worked out with other breast cancer survivors that are have gone through their treatments and they shouldn't, there's always ways to modify what you're doing. So it is helpful when you have some significant restrictions to work out with someone who's experienced and knows what you should and shouldn't do so that you don't get hurt.
I agree. So I also have another question. You started with Pilates, right? And then
Yes.
went to resistance training?
Yes.
Mhm.
Yeah. Yeah. I mean, I also, for me, um, I just keep reading more about the benefits of resistance, like, of lifting weights, essentially. Beth actually was talking to me about it originally, and then I've started looking into it, and there's, I think that it's really important for all women.
Mhm.
I think it is too. I do think it is. I'm hoping I can build it in somehow, but I just I
Mhm.
think highly of those that are able to incorporate everything you want to incorporate for good health.
Right. Oh,
It's
it's
not
a
so easy.
full-time job too,
Mhm.
It's like who has time for all of this stuff, but
But
Routine.
somehow, yeah, and
right.
priorities, just
Right.
priorities.
Right, yeah, you have to make it you have to once you do it for maybe 3 weeks, it's something that is more
Mhm.
innate. But yeah, I would say it takes probably about 3 weeks to start a
At
habit,
least.
at least. Yeah. Yeah.
But now I can't live without it. Like I
Right.
have, I don't, I if I can't do it, I find a way to do it because I don't feel good. So yeah,
Right.
That
Right.
is wonderful. I'd love to get to that point.
Yeah.
I
That
s-
takes real commitment.
I started the same as Dr. Mazor, Pilates, and then now I'm resistance, and now I'm weights. But I can't do it. I can't do all these sets, so I break it up. That's
That's
all.
okay. That's okay. And
Break it up.
you look great and you feel great.
Yes, I'm getting there.
Yes, you are.
Again, thank you.
You're welcome.
Thank you.
My pleasure. This was
Okay.
fun. I'll,
Yes, thank
I'll
you. Ow.
gladly do it again.
Thank you very much.
You're welcome. All right, guys. I hope you have a good night. I guess I'm going to end this.
You too. You take
Have a
good
good
care.
night.
Good night, everybody.
Good
Good
night.
night.
See you soon, Anna.
All right. So see you soon.
Bye-bye.
Bye
Bye-bye.
bye. Have a good night.
Yeah.
It didn't seem like they were hearing you earlier.
I think I was muted.